video illustrates the transoral transmandibular approach for cervical corpectomy. The patient was positioned supine, and the head and neck were prepared and draped in standard fashion. The transoral transmandibular approach to the anterior cervical spine began with the otolaryngology team dividing the lower lip and mandible along the midline. Here, the surgeons use a combination of osteotomes and a reciprocating saw to split the mandible. For this procedure, the patient should be counseled on the need for a tracheostomy and feeding tube due to expected postoperative swelling. Next, the tongue was divided along the midline, along with the posterior pharyngeal wall. This exposed the anterior prevertebral musculature. The prevertebral muscles were divided to expose the C1 through C5 vertebral bodies. Next, an intraoperative CT spin was obtained and neuronavigation was registered to confirm the correct levels for exposure. Then we proceeded with the anterior corpectomies of C3, C4, and part of C2. The corpectomies were completed using a high-speed burr, rongeurs, and kerosene instruments. Of note, the posterior longitudinal ligament was already found to be eroded. However, there was no dural violation during the procedure, and there was no evidence of epidural abscess. For orientation, the left side of the screen is cranial and the right is caudal. Next, trial cages were used to size the corpectomy cage. The corpectomy cage was fit to the C2 to 4 defect, packed with allograft, and expanded. The cage was placed against the superior end plate of the C5 vertebral body and the remaining dens and C1 anterior arch. Here we see the cage being expanded and here we see the cage in its final position. A buttress plate was fixed over the inferior aspect of the cage and anchored onto the C5 vertebral body for stability. Then the otolaryngology team proceeded with closure. The patient was then flipped prone for an occiput to C6 posterior spinal fusion. During this procedure, the left C1 lateral mass screw was removed, bilateral C6 lateral mass screws and occipital plate were placed, and rods were placed from the C6 screws to the occiput. A final intraoperative CT spin was obtained to confirm the position of the hardware. To summarize, here is a 3D video of the transoral transmandibular approach to the anterior cervical spine.